other things that to move on, we had elective surgery lists cancelled because there was not enough oxygen in the theatres to put them under the general anaesthetic. We had emergency surgeries that were usually performed on outer islands without the capability to transport into our hospital, done by junior level interns or consultants, not consultants. And at times, so-called medical officers, which are individuals that have less than a paramedic's training. Several times, again, even just in the general medical ward, we ran out of I assumed, which are cheap and readily available supplies, just like alcohol swabs for taking blood, which then leads to secondary costs on the hospital and on patient outcomes because you end up with contaminated bloods being taken, you get delays in diagnosis, you get misdiagnoses, and you get an increased cost for running multiple bloods with the pathology lab. So we had while I was there, they had a discussion and a talk from the pathology group specifically on why we need to improve and how they can improve despite the lack of resources they have. Outpatient waiting times are often hours, and one thing I didn't include here, which is also very relevant, is the emergency services in terms of the paramedics of the island. They don't have, like we have a call centre where you call 000, get asked for the ambulance, you get referred, and you get immediate treatment until a separate service is sent to your home. The number they have which is a free number to call, goes directly to the emergency department. Is not always answered, unfortunately. Is often used by the children as prank call numbers and things like that, which makes it less utilised again. At which point, if they get through and a ambulance is needed, they send out usually only a nurse with a driver to the individual to pick them up and take them back in. These are some of the interesting cases that we had, all of which I just kind of block them under relevant things. So we had an accident with a 10-month-old girl with burns. Unfortunately, she did pass. It was fairly severe burns, but at the end of my time there, she had passed within a week. Criminal cases, because Tonga, and this is interesting because I didn't directly see a lot of violence in Tonga personally. But like going through the hospital, we quite frequently saw stabbings, drill assaults on a young child, machete assaults. Another criminal case, which is very sad, on an 8-month-old male was kwashiorkor, which is just simply gross malnourishment to the point of muscle wasting, electrolyte imbalances, and this poor child also suffered near blindness in the right eye and corneal ulceration in his left. The two there, medical literacy issues, diabetes, despite the clinic not fully informed patients, and I saw this poor 28-year-old die of renal failure as a result, and the osteosarcoma child also died, unfortunately, because he was treated by Tongan medicine, which led to about a month delay in his diagnosis at the hospital, by which that cancer had metastasized, and there was nothing we could do.
Thanks, Luke.
And, okay, oh my god. Just a last word on the Rotary, because they were amazing. I went and joined up with them and worked with them. These are the general members, all very welcoming, very friendly. Did a lot of different fundraising, and as being an Australian, it was a sausage sizzle. They're doing great work, and touristy snaps to finish. Sorry about going over.